Autonomic dysreflexia is something that you can get if you have a spinal cord injury at or above the sixth thoracic vertebrae or T6, and it can be life-threatening. I am going to explain what it is, what causes it, and how to prevent it, so stay tuned. Autonomic dysreflexia causes an imbalanced reflex sympathetic discharge, leading to potentially life-threatening hypertension. Hypertension is basically high blood pressure, which is why autonomic dysreflexia can be life-threatening. Autonomic dysreflexia can occur in spinal cord patients at or above the sixth thoracic vertebrae or T6. So anyone who is a quadriplegic in the cervical area like me, or anyone that has a spinal cord injury down to T6 or above. Autonomic dysreflexia is a lot more prone to those who have spinal cord injuries that are complete, whereas people with incomplete spinal cord injuries are less likely to get it. What causes autonomic dysreflexia is something that is occurring below your level of injury that would normally hurt if you could feel below your level of injury. So for example, you could be sitting on something, or your bladder could be full, or your stomach could be full, and you need to go to the bathroom, whereas normally before your injury, or if you could feel down there, it would hurt, but since you have a spinal cord injury, you don't have feeling down there. So what tries to happen is whatever is hurting is trying to send a signal up to your brain. However, that signal only goes up all the way to the point of your level of injury. So for me, it would be C5. That signal that it is trying to send stops at your level of injury, and therefore it cannot get to your brain to receive the signal. Your brain realizes something is wrong, so it tries sending a signal down to that area that is hurting to try and notify it to do something. Since these messages cannot travel through your level of injury, it results in a hypertension or high blood pressure. Us having spinal cord injuries, especially quadriplegics, normally our blood pressure is a lot lower than an able-bodied person. So then what happens is your brain tries sending a signal down, but it can't actually go through your level of injury. So what I believe what happens is your heart rate slows down. This is life-threatening because you have hypertension, which is high blood pressure, and you also have a lower heartbeat. These two combinations can actually lead to death. So what can cause autonomic dysreflexia? 9 times out of 10, if you have autonomic dysreflexia, it is going to be due to your bladder. Either your bladder needs emptied, or there's a kink in your catheter if you have a catheter that stays in you, or something is wrong with your bladder. You could also have a urinary tract infection, which can cause autonomic dysreflexia. The second major cause of autonomic dysreflexia is bowel distension and bowel impaction. So maybe you need to take a crap. Some more causes of autonomic dysreflexia is gallstones, hemorrhoids, pregnancy, sexual intercourse, ejaculation, pressure ulcers, ingrown toenails, burns, blisters, insect bites, contact with hard or sharp objects, temperature fluctuations. So if you go from hot to cold or cold to hot, or even if you put your hand in cold water or hot water, that can actually cause autonomic dysreflexia. Constrictive clothing or shoes, that is another common cause of autonomic dysreflexia. So your shoes could be too tight, your pants could be too tight, a shirt, or anything of that nature. Bone fractures, as well as heterotopic ossification or extra bone growth, which I actually have on my left femur, which I broke. So a couple ways that you can avoid getting autonomic dysreflexia is stay on a bowel routine as well as a catheterization routine. So if you stay on a routine and empty your bladder every so often as well as empty your bowels every so often. That should help this tremendously. Another way that you can avoid it is making sure that your clothes are not too tight or anything. Be careful when it is really cold or really hot outside. Another thing that you could do is go ahead and check your blood pressure and get a reading before you get autonomic dysreflexia, so you know your baseline blood pressure. And then if you ever happen to have autonomic dysreflexia, get a blood pressure reading while it is going on and see how much it fluctuates. Lastly, is that you can get an autonomic dysreflexia wallet card from Christopher Reeve Foundation. A link will be down below, and I've actually got one. It fits in my wallet, a trifold wallet, and it tells everything that anybody needs to know about autonomic dysreflexia. Has your information on there, such as your name, baseline blood pressure, and all kinds of other stuff. This is really important because a lot of people that are in the nursing or doctor field to help patients actually have no clue what autonomic dysreflexia is, and have no clue how to treat it, and have no clue that it is life-threatening. I personally have actually had autonomic dysreflexia at least 2 or 3 times. I've probably had them a couple more times, but they weren't as severe. And let me tell you, I had one autonomic dysreflexia on and off for about a month, which was around my birthday. So it was June of 2015. So about 5 months after my injury, or 4 or 5 months after my injury. And the cause of it is that my bladder actually wasn't expanding enough whenever it got full. So when my bladder got full, it had to put out urine so it could get more in, and it wasn't expanding like it normally should, which is apparently common after spinal cord injury. And now I take a blue medication, which is right here. This medication is called Ditropan, and it helps expand your bladder when it gets full. So I take 5 milligrams 3 times a day. So what would happen is my bladder would get full and my bladder wouldn't expand for more urine to go in. So basically I would just automatically urinate, and I'd get a really bad headache, worst headache ever, which was the result of the hypertension or high blood pressure. Really bad headache. It felt like two things squeezing my head and about to crush it. And right at the peak of the headache, boom, I'd urinate and the headache would go away, and about 30 minutes later I'd have the same thing over again, and that occurred for about a month. If you guys have experienced autonomic dysreflexia, leave your stories down in the comments below. I'll be down there reading them as well as responding.